Our guest today is a nurse practitioner that specializes in aesthetics and wellness. Please help me to introduce aesthetic nurse practitioner Jordan.
Thank you, Jonathan. So, like you said, my name is Jordan Naijar. I'm here at Fifth and Wellness in Boca Raton, and I'm very happy to be here. Thanks for having me.
Thanks for doing this. All right, Jordan. So I always like to ask before we dive into the deep questions, how has everything been since COVID-19?
So, since COVID, this industry has blown up. I probably see new patients because of the Zoom effect.
Mhm.
You know, 2 or 3 times a day, they are driven in solely because they would have never come into the industry had they not been looking at themselves all day on Zoom. I
Yeah.
think that's kind of collective across the board. Every injector would say that. Um, we're fortunate for that in aesthetic medicine. I know other people have not been as fortunate, but it's definitely, business is booming. It's great.
Wow, amazing, amazing. So when other industries went down, the aesthetic industry actually went up because people were looking at themselves constantly. That's amazing.
Yeah. So, I feel like with COVID and with medicine in general, when you come, there's very little control we have over our medical health, our decisions. We have to rely on doctors, but aesthetic medicine is something that the patient gets a lot of say in, and I think they enjoy coming. And sometimes we as injectors enjoy that, don't enjoy that. I don't know, but they feel like they have control and they can do something about their health to make themselves feel better. And people are in a world where it seems that there's no control at all of what's going on right now. Having a little bit of control that'll make them feel better has been a confidence boost, has been life changing for people, and they've people that are coming in that you wouldn't have expected.
Wow, that's a really good point that you mentioned because like people don't have control right now. No one knows what's really going on, and to
Yeah.
have that is interesting. Wow, that's really good. So let's go back to the beginning. How did you get started in the aesthetic industry? Like, what made you want to get into this crazy industry?
So it is a crazy industry. It's crazy fun. It's just in its
Yeah,
infancy. But as far as getting started, I had zero want to be in aesthetics. It's nice in South Florida that aesthetics is not taboo. It's something that, it's like going to the dentist.
yeah,
People have their scheduled appointments, they're taking care of themselves. Well, it's not like that everywhere else.
yeah.
I truly started in the industry as a consumer.
Yeah.
And where I grew up, it was very taboo. Um, and even though I was starting to notice lines on my face, I was like, oh, I'm a nurse practitioner. I can go to a course. I can inject myself and tell nobody. Right? And then in that course, I just so happened to be a basic Botox course. I went with a girlfriend. Um, and after I saw my results, I was like, wow, this is very natural. I don't look like Christmas with the Cranks. And I think that the taboo of it all and what was publicized at the time uh, was false, like false advertising. Almost, it was doing a disservice to the industry. So I kind of got like the fire sparked in me to change that, the way that people view aesthetic medicine.
Mhm.
And it's starting. It's definitely starting, especially down here, and with the help of social media, um, to learn what I could learn to help make people look more refreshed, more natural, and just restore their own beauty versus making them look like something they're not.
Yeah, that's a good point. Like it's preventative. It's not meant to like disfigure you.
Right. And confidence is everything,
Mhm.
I had a good friend of mine once say, look good, feel good, do good. And it's so true. I see it every day in my patients in the chair. When they feel better, they go out and they get the sales that they need, or they have the confidence to say hi to that new guy or whoever girl, to go on that date. Like, they feel better about themselves, and that changes the way you feel about yourself, changes a lot.
Nice. Yeah, I know it has a lot to do with like your mental health and really reflection when they sit in your chair. So, do you feel like there's a lot of mental health that goes into aesthetics?
Oh my gosh. I think there's a lot. I mean, it's 80% of the game, I would say. I'm fortunate to, I put my patients on treatment plans, so I don't see them once a year. I see them kind of frequently, so I'm able to check in with them. And there are a lot of times where, why are you doing this? Like, what are we doing? And if it strays away from, you know, that borderline, we need to work on something else or our health, or then we have a conversation about it. A lot of times I do feel, I guess, like a bartender. I don't know. Bartenders say that they're psychologists. I feel like that a lot, but it's a blessing, because if I can do a little bit to improve that so that they can take the next step, then, you know, that's, at the end of the day, we're practicing medicine.
I agree. That's amazing. So I want to talk a little bit about the health side and health that you do here. Tell us a little bit about, besides aesthetics, what do you kind of do on the health side?
So we've been doing a lot. Obviously, the inside nutrition is very important. We do a lot with nutraceuticals, IVs. We're getting people on peptides. Hormone replacement therapy is getting big. We're kind of outsourcing that a little bit, because that's requires a lot of hand holding, and but we're focusing on peptides. We're focusing on nutraceuticals, and skincare is a big one now, as far as the wellness is going.
Amazing. Yeah, I see a lot of, like, especially in South Florida, HRT and health and wellness is huge. In other parts of the country, I've seen them just now starting to get introduced to HRT and peptides and things like that. So you guys are ahead of the game down here.
Peptides are tough. Peptides are really tough right now, only because we're so limited in what we're allowed to use. You know, 6 months ago, it was a little bit different. We had an array of things we could use. Now we're having to, the FDA makes their decisions and changes from time to time, but peptides are awesome to simulate. They kind of, a little bit of the biohacking phase. You can really lean out, sleep better. There's just so many things that they can do, and they're naturally occurring proteins in the body. So
amazing. What's your favorite aesthetic procedure, or to recommend, or to do yourself?
So I don't do procedures on myself. I'm a chicken. But my favorite aesthetic procedure to do would be, I'm really into combination therapy. I don't just do a one and done. Like I said, treatment plans are a big deal for me. But I've been really focusing on repositioning fat pads. And by doing that, it's with threads, PDO threads primarily are what I'm using, to take what patients already have and just reposition them, pull them back up. I'm able to use a lot less filler that way, which is nice. And then when I do use filler, I can place it more appropriately to really, really contour and get longevity out of these procedures. And mostly so you look natural and restored, and take 5 years off.
For like somebody first time coming in, how long would like filler last for? Like how long does it usually last for?
Gosh, filler, everyone's different. It's about your metabolism.
Yeah.
It's about, did you get the appropriate dose? I mean, people aren't really, it's still medical procedures, still medication. People aren't really dosing appropriately, or afraid of the filler face, which is true, which is why I like the threads first and then using the filler to fine tune. But I usually, once I get my patients to goal, I tell them everyone's goal is different. And then once I get you to goal, I need to see you every 9 months or every year to fine tune. Because maybe today we did 5 syringes of filler. If you go what the back of the box says, which is not true, but if you go that long, either 8, 12, 18, 24 months, then you're going to have to start back at ground zero. Oh. So seeing these touch-ups every 6 months where it's 1 syringe, 2 syringe, or every 9 months where we're doing these touch-ups is going to get you further than if we're starting from scratch every single time.
Wow. That's really good information, because a lot of people think, hey, I can stop and go whenever I want to. But if you're not continuing that journey, then you're just starting yourself over.
Yeah, you need to adapt the mentality that it is like a dentist appointment. I mean, you're waiting until you have a cavity.
So I know you obviously have been working in the field for a long time, and now one more time. That's my cut. That was my cut. All right. So I know you've been working in the field, and you've finally broken the industry, and you have a position and things of that nature. I know a lot of newer injectors are going to be watching this, or even experienced injectors. Is there any tips that you would give to break into the industry?
Honestly, to break into the industry, my apologies. Networking is everything. I got my first job because I went to a conference and I rubbed, elbows with the right person, right? So there's that saying, it's not what you know, it's who you know. That's kind of true. We're practicing medicine, you need to know what you're doing. But it is, if you meet the right people, they can definitely set you up. And also having that community to a lot of times you're in a facility all by yourself as the injector. And if you don't have anyone to consult with, if your medical director is not there right away, then having that community to text and reach out to is everything. So as a new injector, networking, go to every conference. I don't care if it's a derm, plastics, AMSPA, AES, whatever it is, that's where to start. Second, to be safe. Your technique is nothing if you don't know how to practice safely. And those only come from continued education, private trainings.
Nice. Now I can definitely understand that. Is there any training or courses that you would recommend for new injectors or experienced injectors?
So, absolutely. I've been practicing for about 4 years, so I would still consider myself on that newer end. But it's a cutthroat industry.
Yeah, for sure.
And the way I started with the anatomy, because the anatomy, yes, it's variable, but it's your groundwork. If you can navigate the anatomy, then you can play a little bit safer. You can try different techniques if you are practicing safely. So I started with books. Chris Sturrock has great books. Those are the books that I bought first because these courses are expensive. And right out of the gate, I couldn't really afford to go to his cadaver class, but I have since invested in that training. I think a cadaver class is, if you have nothing else you can invest in, start there because that's what's going to keep you safe. And at the end of the day, that's what our duty is too. And so that would be ejection with ejection anatomy with Chris Sturrock. But there's a lot of them out there. That would be first and foremost. And then private trainings. The companies, Galderma, Allergan, they'll help you, but you need to invest in yourself. You need to spend the money, save the money. If you can't do it, buy the books, then save the money for the private training. But that's what's going to move the needle. It's going to establish your networking, give you a good mentor. The private trainings, and I have multiple people that I've gone to that I could recommend, but I was going into a niche. So if you have a special niche, then that's what I would recommend.
Amazing. So I wanted to touch on a point that you just made earlier and kind of expand a little bit. So you said when providers start, they might get jobs where they're the sole provider in the office. As a new provider, and I even get companies that reach out and say, hey, I'll take somebody with 6 months, but they'll be the only provider in the office. And it's I wouldn't suggest that's very risky. You want somebody very experienced. What advice would you give for injectors that get those type of offers coming out of college?
So coming out of college, it's tough because especially in this industry, it's really tough. If you're not going to invest in yourself, I promise you these companies aren't going to invest in you.
Gotcha.
And at the end of the day, you have to remember it's your license. So if you choose to take that job and have no mentor, you have no community, something goes wrong, or you have a patient complication, because I will tell you will have patient complications. Maybe not to the extent of an emergency. Thank God they're very rare. But we're in a fee-for-service medicine. We aim to please. So, and your idea of pleasing someone might be very different than that patient's idea. So that's important. Make sure you and your patient are on the same wavelength, because if you're not, then you're setting yourself up for failure. But if you're by yourself in that office and you don't know how, even if it's something as little as they were expecting plastic surgery with a syringe of filler, but you didn't communicate that well, there's no one there to back you up. You don't know who to consult with to tell, the community is everything. So as a new injector, I would try, if you have to take a position where you're 6 months out the gate, and you're there by yourself, and you're probably going to, let's be honest, these med spas are popping up all over the place, and they need injectors, and there's only so many experienced injectors. And most of the time, experienced injectors are pretty happy where they're at because their med spa knows that there's one down the street. So you may be in that situation. And so now it comes on you to invest the money in the training, and you better find a mentor. That's what you need.
So mentorship is key.
You better find one.
What about the relationship between you and your medical director? I would say that's pretty key too.
Yeah, absolutely. If you don't know who your medical director is, then that's rough water. Again, find a mentor. I'm a nurse practitioner. I have full practice authority. That's not something that every nurse practitioner has. You have to be to a certain, you have to have a certain amount of hours and everything. So I can practice. The guidelines, as you know, are kind of gray, but I can practice on my own.
Yeah.
But I have my medical director and I have my mentors that I've trained with. So I still have that second and third layer of protection.
Wow, that's really great. And I think that's necessary because, again, you're practicing medicine. You never know what could go wrong or not. And at least you have that support behind you.
Right. And that's what I tell my patients too. Listen, it's called medical practice. We're practicing.
Yeah.
This is not set in stone. It's not cookie cutter. So that's a good way to put it to patients who just you're not on the same wavelength with.
I know, and I wanted to go into that a little bit more. So they come in with like this idea in their head. How do you even like, someone comes in and they're like, hey, I want to look like this celebrity.
You weed them out. At the end of the day, you're the injector, you're their medical provider. They're relying on you to tell them what is appropriate, an appropriate plan of care, and what's not, and what is realistic.
Yeah.
You know, and if at the end of the day you take that patient on, and if you're not, and this is something you learn in consultation because it definitely takes time, and I'm constantly learning too. You learn with every patient that sits in your chair. Yeah. But the more honest you can be, the more you can scare a patient out of the procedure. Honestly, that's what I do. You sit in my chair, I'm going to scare you out of everything that you think that you want to do today. Yeah. Because when you've made that decision, then I think they have a better idea of what to expect. It's all about expectations and making sure mine and yours meet in the middle and we can come to a plan together.
Great. Is there any celebrity that you get a comment in your office like, hey, I want to look like this person, or?
A lot of people want the Hadid brow because I do threads.
Nice.
And we're getting in a journey together if we're trying to go with the Hadid brow. You're doing your Botox, you're doing multiple rounds of the barbed threads and the smooth threads. And that is not, you have to be genetically, set up for that. So that's the main one that I get. And to be honest, it's few and far between of the patient that's actually going to achieve it.
Nice. Now, I want to do something fun this time. I want to jump into social media and talk a little bit about her pictures on her page and get a little bit more context. So let's start off. Let me get my phone. Let's start off with the first picture. All right. So let's start off with this picture with you at a conference with two of your fellow peers. Give us some more context on this story.
So that is Chris Zurich. So that is the injection anatomy course, recently absorbed by AmSpa, another incredible source, wealth of knowledge for what you can do with your license, which is where you should start if you're getting into this industry. But that's Chris Zurich. He is a plastic surgeon. He's coined the fear of injection is the fear of anatomy, which I couldn't agree with more. Like I said, when I started in this industry, it was sink or swim. Yeah. I mean, everyone's been doing this. They have all their perfect techniques. Instagram makes everyone look perfect all the time. It's a lot of pressure as a new injector. So I started with his books. Yeah. And I was like, one day I'm gonna make enough money to get to his class. And so I recently went. It was amazing. My biggest takeaway from it's fun because you can take the filler and then the didactic was phenomenal, but then you can take the filler and inject where you think you are injecting. It's insane to see just how close you are to certain things. It's a very humbling experience. So I couldn't recommend that that enough. But my mentor also started a cadaver course, 𝐦𝐸𝐬𝐤𝐞, which is next on my list. And as soon as I save the money for that, and cadaver course is invaluable. I think that injectors should be doing them annually, honestly, because you forget. You see so many patients a day and you feel like you're getting a little, the minute you feel comfortable, you need to go to a cadaver course because you need to be humbled.
Continuous education. All right, let's go to the next picture. So this one is actually a before and after of yourself.
Yeah.
Let's get some more context on that one.
So this picture goes to show patients, and even was a wake-up call for me, because like I said, I thought this industry was very vain and kind of the textbook of what you would think of in aesthetics. And this goes to show you that you can just be a more enhanced version of yourself. You can augment here and there and still look natural and normal and not like Christmas with the Cranks. I actually have quite a bit of filler in my face, but the big takeaway from that picture is my masseters and my chin, I would say. But in that photo, you can see cheek filler, a little bit of nose filler, lip filler, chin filler, Botox. And then the big one would be, temples. I did my temples. The big one, though, is the masseters. So that big giant muscle that you can see on the side with the chipmunk cheek, that's a masseter. With Botox, you can paralyze it, weaken it to eventually slim out the face in that case. And that's the big takeaway from that. That first one was probably about a year before the second one. So it takes time. Botox takes time. But you can do some big things. All these injectables, it's not surgery. It's not one and done. You have to combo things. It's also chemical peels. It's a lot. It's on my Instagram. You can read all the things.
Yes, terrific.
I've done.
And then one more is a patient before and after where you use threads, which I hear you love threads.
I do.
So tell us a little bit more about this one.
So this patient came to see me from out of town, specifically for threads. She has an injector for her Botox and other things who she'll continue to see, but her injector sent her down here because she does not do threads. Threads need to be done by somebody who's trained extensively with them. It's not like a one and done with filler and Botox. There's a little bit more hand holding, a little bit more of a downtime. It's more procedural. So she came down to do the full face thread lift. And that's what we did. I used PDO threads for her. We tackled, and everyone has different vectors for where you get the most lift. And hers happened to be the mid-face, the jawline, and on one side was the neck because it was her sleeping side. And it's just about balancing. But that's what we did for her, and she was really happy with her result. We did a little bit of filler in between. Just to fill in the gaps because the threads serve to reposition the fat pads. Yeah. And that's how you can get away with using less filler. But over time, we do have bone absorption and filler and fat absorption, so we can fine tune with filler in the end, but it's best to use the threads first so we can use less filler, get you there naturally and longer.
And the before and afters are so amazing. Like the difference with non-surgical treatment is ridiculous. It's amazing how much it has evolved over the years.
Absolutely. We used to just fill lines, and now we're moving towards replacing volume as we've naturally lost it. And I think it's only in its infancy. There's so much more coming out in the near future. That's why these conferences are so important. I'm really excited about what's coming. I think regenerative medicine is coming. It's a big one. That's what's next on my radar. It's where I started, actually. That was my first job. And I'm headed back to it. Nice. In combination with aesthetics, though, not orthopedic.
Yeah, and I see that a lot. A lot of them teaming up, like a lot of aesthetic offices offering that service, or a lot of regenerative medicine offering aesthetic services. So I can definitely see that. Yeah,
that was the idea where I first started. It didn't quite take off. But I think that's the wave of the future. Less filler, more natural products. Filler is always going to have its place unless you're doing a fat transfer, but It's definitely very exciting.
So I wanted to talk about social media a little bit more in the aspect of how important it is. I know so many injectors use it as a marketing tool, and I know recently that yours got hacked. So I would love for you to explain a
Gosh,
little
don't
bit
remind
about
me
that,
about
um,
that.
and what they can do to prevent that. I know a lot of people that are in the aesthetic community are getting hacked. Seriously,
Yeah, there's something called dual verification.
seriously.
Definitely do that. So I had a love-hate relationship with Instagram. I still do. I mean, like I was telling you before we sat down, I was like, I'm a medical provider. They don't pay me enough to do Instagram, whatever. But I saw the fruits of my labor, honestly, in the treatment room with my patients. They're coming in, your kids are so cute. Oh my gosh, your husband's so hot. What did you do? The masseter one really took off. I can't believe that you looked like that. Like I had no idea. So I've grown to love it because it gives me that community with my patients, and I get to follow them outside of the office, make sure they're doing the right things. But I've loved it for that aspect. Yes, it's a great marketing tool. Personally, I'm not using it so much as a marketing tool. It's definitely it's easier for me to explain a before and after by showing it to you than talking through it. So Matt, it's a highlight of your best work, right? Which we should move away from that. It should be our realistic work. It shouldn't always just be our best work, because that gives patients not the best idea of what aesthetic medicine is. But it's a highlight reel for you. I like that aspect, but truly I like it for the community that it brings me with my patients and with other injectors. I mean, I'm learning things, meeting other injectors from all over the world that are commenting. It's all about community. It's great as far as that regard. Saving your Instagram is very difficult, so just don't ever go down that road where you have to save it. Do the tool, go to security, go to second two authentication and do that. Worth it. Because yes, when mine went down, it went down in about 2 minutes in its entirety. And it was a pain to get back. Oh, and if you blocked me because I hacked you, or you thought I was gonna hack you, I'm not going to. I have it back safely. Please unblock me.
Yes, we're gonna drop it below so you can check it out.
Thank you, sorry.
So I wanted to talk about any people on Instagram that you follow that might be great for viewers to follow. Might be a doctor or practitioner, anyone.
So I follow a ton of people. Yeah. As far as threads go, most everyone knows about Injector Jess. If you don't, you should. I trained with her. She's like the queen of threads on Instagram, I would say. She's definitely utilized that space. She was the first to do it. She knows what she's doing. I was fortunate to train with her. So I like that, to get into the thread space if you're thinking about it. As far as Injector Bunny, I know most people probably talk about her, but she is honestly just a great person. I don't know how or where she gets all the time to do what she does, but she will respond as an injector. She will respond to you like she's known you your whole life. It's insane. She's always posting informative things. Who else? Dr. 𝐦𝐨𝐫𝐞. He's raw. He's real raw. We'll get it. I enjoy his posts. There's a lot as far as like the big names on Instagram. As far as like community that I would recommend to know in the industry, Dr. 𝐦𝐨𝐲𝐬 is my mentor. Like I said, he's just an incredible human. He does private trainings as well. And he's the first person I text about anything. So he's on there. Danielle White. Love her. She's also just an amazing human. She'll too talk to you like she's known you your whole life, even if you're like Joe Schmo from nowhere. As far as in Boca specifically, Letus, Thread Slayer, just amazing. We had, we were in Peggy Zapatis, I believe. Also, just great community people that will be there in a drop of a hat to help you. Those are all great people to know and to have as mentors in your back pocket.
Great. And we're going to drop all those names below so you can follow them, check them out. I'm sure they'll have a lot of tips to share. And like she said, if you need advice, maybe jump in their DMs.
Yeah, they're great. So just to reiterate, Instagram is a highlight reel. It's fake, but it's not fake. But just take it with a grain of salt. So the injectors that have 17,000 millions of followers, yeah, they're amazing. But I've also treated patients who have come from those injectors, and not to knock any work. But what I'm saying is not to knock somebody who's not crazy built up on Instagram, because some of the best injectors that I know and I've trained with, they do still have that medical mindset where they're like, Instagram's below my pay grade. And they're a wealth of knowledge too. So don't just knock somebody because they're not building that social media, feel good in you. Because chances are they may know a lot more than the person that does have that big following.
No, I couldn't agree more with that. There's so many like fake followers and things like that. I've met a lot of providers that don't even have social media that have been doing this for so many years, are a beast at it. And then I met some providers that have a lot of followers on social media, and maybe they're not still the most confident injector. So I definitely do think
it's definitely it's also kind of, some people find joy in social media, and some people like me I only find it when I find connection with my patients. I don't enjoy scrolling, and it's a lot of work to do social media. It's a whole other job. The hashtags, making sure that they line up and the algorithm and make sense. I mean, it's a lot of work, and it can be discouraging if you're a new injector to see big injectors and think that you're not quite there and you're never quite going to be there, especially because the algorithm is changing all the time and making it really hard to get organic followers. So don't let social media discourage you. Use it, because there's no better tool to know your patients. But especially if you're new in the industry, don't let that deter you from doing what you're doing or finding people to train with. And don't go train with somebody because they have 1 million followers and that's why you want to train with them. Believe me, learn from my mistakes. They don't always have the wealth of knowledge that the provider has who isn't active on it in social, because chances are they're studying instead of scrolling.
I can agree with that. Well, thank you so much for sitting down with me, talking about your passion of aesthetics. Tell everybody where they can find you, what you got planned next, things like that.
So here I am in Boca. Thank you for making the trip up. I'm at Boca and Fifth and Wellness. You can find me on the Fifth and Wellness page. You can find me on my personal page, Rejuvenate. If you have questions, please. My DMs are not really full that often, so you can message me there. And as far as my next steps, I'm really into combination therapy. So you're gonna get a little bit of everything. Don't come and expect a one and done, because it's gonna be a couple steps. And my next I have multiple trainings that I'll be listing on my page shortly that I intend for 2022 that I'm attending. But I think I got to bring regenerative med back. I got the PRP in the office, but I still need, there's so much more.
And that's huge. Stay key to that. I'm telling you, everyone. Huge stuff.
It's next. It's what's coming. But for now, threads and filler.
Amazing. Well, until next time, bye.
Thank you for having me.